Hi, how are you?
Hi there. Hi, Dr. Fouquet.
Good to see you. So good to see you.
You
How's
too.
everything going?
Good, good. Just getting started over here. I'm on the West Coast, so it's still morning. Yes.
We're halfway through our day right now, Dr. Nishi. So so far, December 2nd is a good day. That
Yes. Wonderful.
yeah, really excited. I've been so excited about this talk, and I was just kind of getting started. So what I'll do is maybe have you introduce yourself, and then we'll kind of get started. Does that sound okay?
That's perfect. Great. So, well, thank you so much for having me here today. I'm really excited to talk about sleeping medications, which I think we're both passionate about, and educating people on. So I'm Dr. Nishi Bhopal. I'm an integrative psychiatrist and sleep doctor. I'm based in the San Francisco Bay Area, and I have a private practice called Pacific Integrative Psychiatry, where I help people with anxiety, depression, and sleep issues. And I also have an online platform called Intrabalance, where I teach doctors and therapists about how to help their patients sleep better.
That's awesome. That's really so what brought about this passion? Tell me a little bit about that, like your interest in sleep, because I always find that very fascinating with people that I've talked to are in the sleep field.
Yeah, I mean, I think for me it was kind of personal. Like I'm someone who always struggled with sleep in different ways. Not so much insomnia for me personally, but more on the other side, excessive sleepiness and
Mm-hmm.
not getting a handle on my sleep schedule. I was one of those teenagers that stayed up way too late and I couldn't get up on time for school. This carried through university and medical school. I had a hard time in residency with this. And so I just really wanted to understand more about what was going on with my own sleep schedule. But then, as a psychiatrist in training, I mean, we see so many patients with sleep issues. There's a lot of overlap between mental health and sleep. And so that kind of piqued my curiosity. And I learned that sleep medicine was actually a field that a doctor could pursue. I didn't even know that. I was like, oh, you can study that. So, yeah, so then I went and did a sleep medicine fellowship after my residency training.
Awesome, awesome. Funny, yeah. Our stories kind of similar in the sense of the experiences we had. For me, it was insomnia and sleep deprivation. And one of the things I always tell people is, I hope I'm not freezing. Can you hear me okay?
Yeah, we're good.
Perfect. One of the things I'm always telling people is they're two different things, right? Sleep deprivation or and insomnia, but sometimes they sort of co-occur. But it helps to figure out what is driving what, because that will determine what your treatment options are. And so maybe this will make a good segue to generally what kind of sleep issues do you see in your practice?
Yeah, so I think that's a great point that you brought up, right? Because I do get people coming to me for help with insomnia, but then when we start to peel back the layers, we start to realize that it may not just be insomnia. There might actually be other issues at play. And so some of those issues that I'll see in my practice are things like restless leg syndrome. Especially with psychiatric patients because they may be taking SSRIs, so medications like Zoloft, Prozac, and so forth that can cause those types of issues. There may be a circadian rhythm disorder, like what I was struggling with when I was younger. So that's when people have a misaligned sleep schedule. It doesn't line up with their day-to-day demands. So there may be something like that. There also may be undiagnosed sleep apnea, which is very common. And then there also might be underlying mental health issues that are then contributing to the sleep struggles because there is a bidirectional relationship with anxiety and depression and sleep. So that's kind of the bulk of what I see in my practice.
Yeah, yeah, no, absolutely. Would you say, do you feel like insomnia, because that's something I've been seeing just a lot more people complaining about. Do you feel like the prevalence is increasing? And if so, what do you think are some contributors to that?
Yeah, that's a great question. I'm kind of noticing that as well in my practice. It seems like everyone is struggling with sleep. in some form, right, these days. And so we know the prevalence of insomnia is increasing. About 30 to 40% of Americans experience some form of insomnia at some point. And there's some studies showing that the prevalence is increasing every year. And I think there was a recent study, well, semi-recent study showing that it increased like by almost 10% over the past 10 years. And I think there's a lot of reasons for this. So I kind of like to break it down into three big categories. So one reason I think about is social. So kind of larger social issues. So an example of this would be the pandemic, right? So we all went through this huge social change in the past couple of years. Think about things like political strife, like war, unemployment, financial issues, right? So these big social issues have an impact. Then I think about lifestyle. So I talk to my patients about the fact that most of us have a light deficiency during the day. We're just not getting enough bright light, and especially with seasonal affective disorder, with depression. And then we have a darkness deficiency at night. We're getting too much light when we're not supposed to. So I think about that. I think about irregular sleep schedules. Other lifestyle factors could be consumption of alcohol, caffeine, even nutritional factors have an impact. Even simple things like your environment, having an uncomfortable bedroom. So I have a patient who, she came to me looking for help with sleep, and she'd been struggling with insomnia for like almost a decade. And so one of the first things I do is go through a checklist with regard to their bedroom, because I like to get a really good visual of what a person's bedroom looks like. And it turned out she was sleeping in almost like a broom closet. She lives in a small studio apartment here in San Francisco. And so she was sleeping in a closet with no ventilation, and she literally couldn't breathe. So I just had her move her bed out, and her sleep improved almost overnight, right? So these simple things, these lifestyle factors. And then the third category I think about is medical. So is there sleep apnea? Is there something psychiatric that we need to address? Anxiety, depression, PTSD? Are there medications that the person is taking that could be disrupting their sleep? So social, lifestyle, and medical, that's kind of how I think about it.
Yeah, I love that. I tend to group them into more like kind of like three different categories as well. I just kind of name them different. So the first usually is the medical issues, right? We talk about like if you have reflux, if you have asthma, if you have sleep apnea, restless leg syndrome, you're going to have sleeping difficulties. And then the middle one is more of those like sort of behavioral, environmental, like you talked about. And then the third is, things that are present during the day. That also has its presentation at night, like anxiety doesn't suddenly go away once your head hits the pillow, right? It manifests in a different form, racing mind or racing thoughts, or ADHD or autism or things. They all have sort of their night presentations or their sleep related issues too. And I think it's so helpful. I love how you put those categories, because then you know where you need to focus on. It might be all three, it might be one or the other. It may need to be done in some order or the other, but I think that is really, really helpful. Especially because people come in and they're like, I can't sleep. And you're just like,
Yeah.
so many things. So when you're able to have it in those kind of buckets, it's really helpful. And I would imagine that's also helpful for, practicing physicians out there who see these patients before we do, like kind of helping them to tease out where they need to put their focus and their energy on. So that's really, really good. So let's move to the topic for the day. I'm excited. I don't know how many if I had $1 for every medicine, what pill or medicine over the counter versus prescription that I got, like I would be like super wealthy, right? So
Yes.
why is there, and there's been an increase in the need. I have some thoughts about why that is. As related to some of what you talked about, the social issues, the culture, just this fast-paced culture we're in right now. I think it's driving some of that. But what are your thoughts on it?
Yeah, I mean, I agree with that. I think, yeah, there's all these issues that we just talked about. And also, so I have kind of like a perspective that I think sometimes in sleep, we almost do patients a disservice because we talk so much about the negative repercussions of insomnia, and then it actually increases people's anxiety about it, and then they want to reach for a pill to, almost get that quick relief for it, right? And so I think we, as sleep physicians, we also need to be careful about how we talk about these things, because I think what's important for people to recognize is that sleep fluctuates. It changes across the lifespan. It can change from night to night. And so when you have that information, it can be really empowering, so that you're not always reaching for a pill to kind of fix the issue and alleviate your anxiety about your sleep.
Yeah, no, that is so, so true. I think, generally advocating for healthy sleep and prioritizing sleep is good, but I feel like a lot of times the people that are seeking this information too, maybe people who have insomnia, in which case sometimes a lot of the work we need to do is around those beliefs, right? And so sometimes it's saying, okay, yes, 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 sleep is important, but you're not gonna die, hopefully,
Yes.
striking that balance. I think that is so key, because then they're like, I'm super inspired to make a change. Fix it for me now.
Yes.
So that being said, how do you tend to approach, first of all, insomnia? What's your first line go-to treatment, and what's your approach? And then we'll go on to medications.
Great. Yeah. So the first line treatment for insomnia is cognitive behavioral therapy for insomnia, also known as CBT-I. So this is the first treatment that is recommended by the NIH consensus and the American Academy of Sleep Medicine. So this is the first thing for people to do if they're struggling with insomnia. And it's really effective. It works really well. It actually works better than medications long term. It doesn't have side effects, and it's safe for people who have other medical issues. Because like we were discussing before, insomnia usually doesn't exist in a vacuum. There's usually other things going on. So if somebody has, chronic pain, fibromyalgia, PTSD, maybe they're struggling with substances. There might be other, cancer, other things that are going on with them that are contributing. CBT-I is totally safe and very effective for those patients. And it can be done one-on-one with a therapist. It can be done in a group setting. It can be done on an app. It's actually much more accessible nowadays than it was like 5 or 10 years ago. So yeah, that's the first, because I hear this from my patients a lot, that they'll say, oh, I already tried that. I tried, not having caffeine after 2 p.m., that type of thing. But actually CBT-I is much more than sleep hygiene. Sleep hygiene is a small component of it, but there are lots of other components to it that are very, very effective.
Yeah, I love that. And I love that there are no side effects. And for me, one of the things that I always tell patients is, even if you learn those skills now and your sleep gets better, it's something you can come back to, right? So it's because, again, sleep difficulties kind of occur in waves. And so that's just incredible. So that's perfect. I love it. Now we go to medications, right? So we built this. I think I'm loving how we're going with this. We started off with, what are the most common things? What can happen with your sleep? What happens when you have insomnia? And then what are the ways? How do we move forward with it? First of all, we didn't even define insomnia. Maybe we'll start with that and then we'll go to medications.
Sure, yeah, definitely. So insomnia is defined as difficulty falling asleep or staying asleep at least 3 nights a week for at least 3 months.
Yep.
That's it.
That's it. Oh, there's sleep opportunity, but you just are not able to make use of it because of different things that are going on. So perfect. Now, when it comes to medications, what's your typical approach? And then maybe you'll take us through more of like the groups of medications that people should be familiar with.
Definitely. So the way that I think of medications is that they're not good or bad, but they are a tool. So like any tool, you want to use it in the appropriate way at the appropriate time, right? So you're not just going to go around with a hammer hitting things, right? You're going to hit a hammer on a nail. So that's how I think about medication, is that you want to use it at the right time for the right purpose. And so how do we know it's the right purpose? Well, I go back to those issues that we were talking about at the beginning, those causes of insomnia, to see first, okay, what is going on here? Is there some other medical issue underlying? Is there something lifestyle, environmental that we can address? Now, if someone is going through an acute stressor though, so I'm a psychiatrist, I see people who are dealing with a lot of very serious life issues. Maybe someone's going through a divorce, maybe they're grieving the death of a loved one, or there's some other big stressor going on. Medications can be helpful short-term in those types of situations to give someone a bit of additional support while we work on all of those other things. So we work on CBT-I, we work on lifestyle, and these other, aspects that we've discussed. One other thing about CBT-I that's important for people to know is that, like you were saying, it gives people those long-term skills. And there's also data showing that when people practice CBT-I, it helps with other things too, not just sleep. It helps with depression. It helps with anxiety, right? So there's far-reaching effects. So I really emphasize to people, if we're going to use a medication, we need to have a plan in place of how we're going to treat the sleep long-term so that they're
Yeah.
not just relying on that medication.
I love that. I love that so much. So it is more of, first of all, you need the person kind of present. You need to help sort of take the edge off first. And so maybe medications required needed. And then in some situations, there are people who, for some reason or the other, CBT may not be effective. And so you've done that, and I think it's important to have a game plan, not as a fix, but maybe a bridge to the fix. So I think that's just a phenomenal approach. So tell us, now we've made the decision, we've decided, you know what, we're going to have you, work with, maybe do CBT-I, or you're coming back saying, listen, we've done it, these are just some of the residual pieces, we need this help. What groups of medications do you tend to use? And again, one thing we have to put out here, this is by no means any medical advice at all. We are here to educate and empower you as you watch this, so you know a little bit more, and so you can advocate for yourselves. But if there's any medical issues, we are not privy to that. And so your physician, everybody deserves their own treatment team. And so your physician, your provider, your psychiatrist will help guide you in the right direction. So that being said, let's go for it.
Yeah, absolutely. So great. That's a great reminder. And so, okay, so there's a few major categories of sleeping medications that a person might consider, or your doctor might consider for you. So the first is things like benzodiazepines. So these include medications like Klonopin, Xanax, Ativan, so that sort of family. The next is kind of non-benzodiazepine hypnotics. So this includes so these are known as the Z drugs or the Z drugs. So this includes things like Zolpidem or Ambien, Lunesta, Sonata. And actually, it's really interesting. So I was looking up that this class of drugs are the most commonly prescribed hypnotic agents worldwide. And the prescriptions of them exceed $285 million in the US, right? So these sleeping pills are a big business. And so, again, important to, if you're going to be using these, have a plan, have a game plan. So you feel empowered to not have to rely on them every night. So benzodiazepine Z drugs. Then there's this kind of newer class of drugs called the dual orexin receptor antagonists. So this includes things like Dayvigo, Belsomra. Then we've got the histamine antagonists, so things like Doxepin. We've got melatonin agonists like Ramelteon. And then we've got other sort of non-sleep specific medications. So these might be things like certain antidepressants. So Trazodone, Remeron or Mirtazapine. Certain anti-epileptics may be used. Sometimes gabapentin would be considered off-label. So there's a whole array of different medications, and different ones might be suited for different people depending on their situation.
Yeah, and is unique. I mean, those statistics are staggering, and I think I read somewhere too. The just sleep medication industry is up to like 4 billion upwards, and it's just incredible when you're saying even just with the Z drugs alone, we're looking at 200 million. So this is not. I mean, this is not. There are situations when it's needed. I think the key is realizing, going back to your why, like, do we need this? And if we do, how long are we going to be on it? Because there are side effects, right? A lot of this. So maybe we could talk a little bit about some of the side effects and things that people should be aware of also as they get on this medication.
Definitely. So one unusual, or maybe not unusual, but strange side effect that people should be aware of, especially with these Z drugs like the Ambien family, is something called a parasomnia. And these are complex behaviors that happen during sleep where people might not realize it's happening, but they'll get up and they might engage in sleep eating, right? So they'll go and they'll eat an entire pizza and they won't have any recollection of it, or sleep driving. And this can be very dangerous. People can fall off, their balcony. They fall downstairs. So this is quite an important side effect for people to be aware of, because I'll see this in my practice where people kind of mention it casually. Oh yeah, there was this one time, like I had a patient who was getting up and eating candles, like candle wax in the middle of the night, and didn't know that that could be a side effect of his medication, right? So that's important to know. But other more, sort of general side effects are things like dependence. So people can develop a dependence on the medication, especially the benzodiazepines or the Z drugs. They can develop rebound insomnia, which means that you have insomnia when you don't take it. So they start to cause the very issues that you're trying to treat. You can get withdrawals. So with some of these meds, it's not safe to just stop them abruptly. So if anyone's listening and you're taking these medications, don't just stop it. Talk to your doctor about how to taper off safely. That's really important. Sometimes there's daytime side effects. So grogginess during the day, feeling sedated. I'll see patients even who just start to feel more depressed during the day, or they have trouble concentrating. They have memory issues, and they don't realize it's connected to long-term use of these medications.
Yeah. Yeah, I mean, these are serious side effects. So this is not something we take lightly. And I think I'll just also include the risk of falls, especially for people who are older, and falls, fractures, and things like that is definitely a risk, just because of how drowsy people tend to be. I have one funny story where we're close to rounding up, but I have to tell this. So I heard there was someone who was actually on a Z drug, and there was this other family that called the police because they had this man in their laundry room folding laundry in the middle of the night, 6 foot guy. So they called the cops. So they had to reach out to his prescribing doctor, who then had to testify to say, yes, he is on, I think it was on maybe
Oh my God.
I just thought I will never. But that was the funny thing, but it is real. These behaviors, these parasomnias, these behaviors that you might end up developing on this medication. So the medications themselves are not bad. They play a role. But I think what we're trying to get out here is there are other strategies to manage your sleeping difficulty where you don't have to rely on them. If you do need them, they're there. But then it's important to really pay. I know, right? It was so funny. So I think that's just really an awareness that we're hoping that this will bring about. And then one last question I had for you is, people have asked also, do the sleep medications mimic normal sleep? What do you think?
Yeah, so it depends on the medication. So some of them do kind of mimic, they don't have a huge impact on sleep architecture, but there are other medications that can be quite disruptive. So especially some of the ones that are more in the psychiatric class of drugs, we can see disruptions with REM sleep and deep sleep. So the short answer is it really depends on the drug.
Absolutely. What about supplements? That's the other piece I hear a lot. Valerian is a big one.
Supplements are another big business, right? Like it's a huge industry. And
we need to get some shares in this.
I know, totally. Absolutely. And I see Dr. Val is asking about melatonin. So I think we even probably do a whole Instagram live just on supplements. But so quickly, yeah, so there's different classes of supplements too. So you've got like the herbs and botanicals. So these would be things like valerian or lavender. Then you've got the melatonin, which is a whole thing of itself, which is a hormone, really. And then you've got other things that are more dietary supplements. So like iron, which could be helpful for restless leg syndrome. You've got like B vitamins, vitamin D. So there's lots of different kinds. Briefly on melatonin, to Dr. Val's question. So with melatonin, it's a body clock regulator. So I think of it more as something to modulate the circadian rhythm rather than as a sedative for sleep. There is some data showing that for people over 55, extended release melatonin can be helpful because our natural melatonin production in the brain actually decreases as we age. So for people who are over 55, long release melatonin maybe could help with sleep maintenance. There's some studies showing this. So she's asking also, can people become dependent on it? I actually have seen that in my practice where maybe there's some physiological dependence on it, but there definitely could be a psychological dependence that can develop when you're taking something external, hoping it's going to help you sleep, right? So that's something to be really mindful of. And I have had people experience vivid dreams with melatonin, sometimes nightmares, and sometimes even have a kind of a low-grade depression from long-term use of it. So just a few things to look out for. And lastly, I'll just say quickly, because I know we're running out of time, which is that just because something is natural, it doesn't mean it's safe, right? So always talk to your healthcare practitioner to make sure it's appropriate for you to take.
So that's a soapbox I just always find myself getting on. The fact that it is natural and a supplement, it's a hormone, especially melatonin. And in some other countries, I believe in the UK, for instance, it's some of in those places, sometimes it's prescribed. So we have to really back of our minds. That's really, really important to pay attention to. So using it just like, especially for our young kids, I see that a lot. And I do agree that there may be some elements of dependence more from a psychological standpoint, because you feel like, oh yes, it's safe or whatever, and then your kids are like, I want my gummy. I have kids who are like, I want my gummy, I want my gummy. I mean, so, and I've seen parents give them just a chewable vitamin and the kids sleep.
Yeah,
So,
the placebo.
so I think there's also that placebo effect as well.
Yeah.
But that's something to pay attention to. Yeah, I agree. Oh, and then I think there's a question about depression and melatonin. I think you had mentioned that too. Yes, exactly. So I also would just plug in now. I think we've covered so much in in less than 30 minutes. Each one of the things we've talked about is alive in our or a masterclass. Yeah. So, but I hope that we've kind of triggered some thoughts around sleep medications with this for you all. And this has been incredible. What do you have any final thoughts for us, Dr. Nishi? I've learned so much as well.
Sure. Well, thanks, Dr. Funke, for having me. So, yes, final thoughts. Sleep is highly treatable. So if you're struggling with sleep, there is hope. Go and talk to a sleep specialist and figure out what's going on. And, it takes time. You need a little bit of patience and try different things under the guidance of a trained professional. But sleep does and will get better.
Awesome. I love it. And so how can people find you? If people say, you know what? She's going to fix my sleep problems. She is the one. So where can we find?
So for people in California, you can work with me one-on-one in my private practice, Pacific Integrative Psychiatry. So you can follow me on Instagram at Pacific Integrative Psych. For therapists, physicians, or anyone who just wants to learn more about sleep, follow me on YouTube at intrabalance, INTRA balance.
Awesome. And I'm going to have that also in, once we share this video, so y'all can just click the link and go right over to follow Intrabalance. Thank you so, so much. And I hope you have a great weekend and a great rest of your day. And thank you everyone for coming.